Welcome to my YouTube channel Logic Medico. Today's topic for presentation is carotid triangle of the neck. Objectives of today's presentation: case scenario, introduction to the anterior triangle, carotid triangle, where the carotid vessels are there, the location, boundaries, contents, clinical significance of the same carotid triangle. Case scenario: 55-year-aged man came to the hospital with complaints of swelling on the left side of his neck since 1 year. So there was swelling in the left side of his neck since 1 year. There was a pain in his neck as well, but that was noticed since just 1 week. Giddiness has started for him since 2 days. So there is giddiness, there is pain, and there was a swelling since 1 year. So this is the swelling. There's no swelling here. Here swelling is here in this area. Carefully observe. So coming to the neck, dimensions of the neck. In 3 dimension, it is a cylindrical shape. On side profile, it is quadrangular in outline, having the following boundaries. This is the anterior boundary of the neck, which will be short. This is the posterior boundary of the neck, which is longer. This is the superior boundary of the neck, which is formed by the mandible, and this is the inferior boundary of the neck, formed by the clavicle and the upper border of the scapula. So this quadrangular shaped neck is divided into 2 triangles by the obliquely placed muscle called as sternocleidomastoid. A triangle behind that is called posterior triangle, and a triangle in front of it will be called as anterior triangle. So this sternocleidomastoid will divide the neck, quadrangular shaped neck, into 2 triangles, an anterior and the posterior triangle. Orientation of these 2 triangles: the apex is pointing upwards towards the skull and the base is towards the clavicle, that is the posterior triangle, while the anterior triangle is exactly opposite. The base of this triangle is towards the mandible and the apex is towards the sternum. Further subdivision of the anterior triangles into a smaller muscular triangle, and one digastric muscle is bounded by digastric triangle, and submental triangle beneath the chin is the submental triangle, and last but not the least, this triangle is called as carotid triangle. It's the most difficult triangle because all the boundaries are different. Digastric triangle, both anterior inferiorly and posterior inferiorly, anterior and posterior of digastric, superiorly mandible. It's very easy. Muscular triangle also muscles, which is also easy. Submental triangle is the easiest of the lot. But carotid triangle, all boundaries are different, so most students find this carotid triangle as difficult. So let's see how we can go about this. The boundaries of this carotid triangle can be divided into the following heading. Which is the straight most boundary out of the 3? The posterior boundary, just give it a thought, will appear like more straighter when compared to the other 2. So the posterior boundary is straighter. It is formed by sternocleidomastoid. While the anterior, when the one boundary is posterior, the other 2 boundaries should be anterior, because triangle will have only 3 boundaries, while the neck has got 4 boundaries. So the other 2 boundaries should be anterior. This anterior inferiorly is by omohyoid, and anterior superiorly it is by digastric muscle. For time being, you just think it's digastric. Which belly? See, you can only see it yourself. Anterior and posterior belly. So it's a posterior belly of digastric. Which belly of omohyoid? Inferior belly or superior belly? It's a superior belly of omohyoid. So all that you have to remember is the posterior boundary is straighter and it's formed by sternocleidomastoid. Remaining you will tell by automatically. So this is the boundaries. If you don't want to write that kind of diagram, you can write simple line diagram like this with some short form. Sternocleidomastoid posteriorly, while this one anterior superiorly it's a digastric, anterior inferiorly it is a omohyoid. This will be the superior belly of omohyoid and this will be the posterior belly of digastric. That's fine tuning. So I hope you understood the boundaries of this. The roof, coming to the roof. Roof is formed by the skin. Superficial fascia, in which one subcutaneous muscle, skeletal muscle is there, is called platysma. Cervical branch of facial nerve, which supplies this muscle, platysma, comes over here, and also cutaneous nerve of the neck, transverse cutaneous nerve of the neck, is also present in the superficial fascia. As well as we can see investing layer of deep cervical fascia. It forms a tight sleeve around the neck. It's like a sleeve for the neck. Investing layer of deep cervical fascia. Coming to the floor. Floor is formed by a membrane between thyroid and hyoid bone. It's called thyroid membrane, and 2 constrictors of pharynx. This middle constrictor and inferior constrictor of pharynx, where the bolus of food goes down. When middle constrictor contracts, inferior constrictor will relax, and the food comes further down. When inferior constrictor contracts, the esophagus will relax, and the food goes through the esophagus and slides down into the stomach. So the pharyngeal muscles are there in this floor. This is the outline of the carotid triangle. Come to the contents of the carotid triangle. Carotid triangle is called so because it contains mainly carotid vessels. The common carotid artery, splits up into external carotid, which gives branches in the outside of the head and neck, and internal carotid, which goes without giving branches in the neck, but it goes inside to supply the major organ of the body, that is the brain. So internal carotid artery goes inside, it doesn't give any branches. The one which appears in dissection also, when you are seeing, if it is giving branches, that means it is external carotid. One which was not giving any branches is internal carotid. It's as simple as that. So it gives, this external carotid also gives so many branches in the neck. So it is giving one branch to the pharynx. Since it is resting on the pharynx, it has to pay the pharynx, ascending pharyngeal artery. Then it supplies the upper portion of thyroid gland, superior thyroid artery. It supplies the tongue, from which we are speaking, lingual artery. It supplies the face, facial artery. It supplies the occipital region, occipital artery. All these branches of external carotid artery are found within the carotid triangle. Mainly this common carotid, external carotid, internal carotid, together called as carotid arterial system, is present in this triangle, and therefore the name carotid triangle. Other contents include the vein, internal jugular vein. It is a partner for the carotid arterial system. So this internal jugular vein receives the facial vein. Facial vein joins with the anterior division of retromandibular vein to form common facial vein. Then ends up in internal jugular vein. The vein draining the tongue, bottom of the tongue, will be drained by lingual vein. Then also one vein from the pharynx, it's called pharyngeal vein. So all these veins will end up in IJV. Internal jugular vein is a partner for carotid arterial system. Coming to the nerves, nerves is actually easier than the list of this. If you just observe here, there are 3 nerves here. You can see 10th here, 11 here, 12 here. You take 3 fingers, one is going straight down. It's called the vagus nerve. It is going down within a sheath called as carotid sheath. It has to supply GAT. Where is GAT when compared to the neck? It is inferior. So it's going straight forward down. Straight down. Next, after 10 comes the 11, spinal accessory nerve. If you know it supplies sternocleidomastoid and trapezius, it has to go behind. So it's going behind to supply one more muscle. What is that muscle? Trapezius. So it's supplying sternocleidomastoid, 11th cranial nerve. Then one more nerve goes forward because it has to supply the muscles of the tongue. That muscle name is 12th cranial. That muscles of the tongue, the nerve name is 12th cranial nerve or the hypoglossal nerve. So this 11, 10, 11, 12. All these 3 cranial nerves are present in the carotid triangle. In addition to this, behind this carotid sheath there will be one chain. It's called symperitic chain, and this vagus nerve gives branches to the larynx, superior laryngeal nerve. Splits up into internal laryngeal nerve. If your friend cracks a joke while you are drinking water, you will get cough because of this nerve, internal laryngeal nerve. And when teacher yells at you, that is external laryngeal nerve. It supplies one muscle sitting on the outside of the larynx, cricothyroid. So both these branches are present in this triangle called carotid triangle. Other contents include a sheath called as carotid sheath and lymph nodes around this internal jugular vein called as deep cervical group of lymph nodes. Come on to the last topic, that is a clinical importance. Carotid pulse can be felt on the anterior border of the sternocleidomastoid opposite to C6 vertebra. That part is called as carotid tubercle. There can be abnormal dilatation of the arterial wall due to atherosclerosis, and that is called as aneurysm. It can happen in any artery. It happens in carotid artery aneurysm. There can be congenital cyst which is present from birth. It is present along the anterior margin of sternocleidomastoid, and this congenital cyst grows with the age of the patient. It's called branchial cyst. And thyroid swellings, they are present in the anterior midline, lowermost part of the neck, anterior midline. These swellings moves upon deglutition. Now to the lymph node swellings, it can happen anywhere, including the carotid triangle. They are present along the anterior margin of sternocleidomastoid. So these swellings has to be distinguished from one another. So these are the clinical importance of knowing carotid triangle and its contents mainly. Coming back to the clinical scenario, 55-year-aged man came to the hospital with complaints of swelling on the left side of the neck since 1 year and pain in the neck since 1 week, and he got giddiness since 2 days. So here is the person, here is the swelling. So this person can have either, it cannot be thyroid swelling because thyroid swelling will be here. It is over here, so it can be a lymph node swelling. It may be pressing upon the carotid vessel, or if his age, he's got atherosclerosis of the carotid arterial system which is increasing, therefore is getting giddiness, or a lymph node pressing upon the carotid arterial system, that thereby causing decreased blood flow to the brain, causing giddiness. So main symptom, he has got giddiness. So why he didn't, these many years he didn't have giddiness? Because the swelling was too small, it may not have. But anyways, we have to confirm that on palpation, if you feel one thrill, and if you hear a bruit on auscultation, that means it is a carotid atherosclerosis or resulted in carotid aneurysm. Otherwise, it can be a lymph node swelling also, that you may have a fever, other associated symptom. So in lymph node swelling, it can be a tumor also, or just an infection. If it is suspecting tumor, we have to do FNAC of that. Before doing FNAC, we should make sure that especially in this region, the common carotid artery, major arterial system is there. So we should not puncture those things, and make sure that it is not a carotid arterial swelling itself. So these are the differential diagnosis of this case scenario. Thank you for watching my video and learning. Kindly subscribe and press the bell button to get the latest video updates. Like, comment and share this video with your family and friends. Thank you once again.